So welcome to everybody who made it today for this first session of the Young Scientist Network webinar. We're very happy to have you with us today. My name is Neyman. I'm the global communications officer of Target Malaria. I'm here today with my colleague, Lorraine Gibson. Lorraine, you want to introduce yourself?
Sure. So hello, everyone. So I'm Lorraine, and I work with Ndayman in the global communications team. And my role focuses on social media. So yeah, it's very nice that you've all joined us today.
Thank you, Lorraine. Just wanted to welcome all the members of our network. We have people connecting from Target Malaria Uganda, Target Malaria UK. So welcome to all of you. We are very happy to receive you today for this event, and our guest today is Mr. Odinaka Kingsley Obeta. Just to remind you, today we will be discussing about Odinaka's experience in advocacy. So the team will be from community outreach to policy development, my journey in malaria advocacy. I also wanted to tell you to feel very welcome to, discuss, because this is really a discussion today. So feel free to use the chat to already to say who you are and where you're connecting from, which city you will be connecting from. It will help the other members of our network also, get to know you better. And also, we will have the opportunity to discuss extensively, in maybe half an hour. We'll open the Q&A feature of this webinar. So you will just have to type in your question there, and we'll answer it orally. So just to give you maybe more information on our guest today, who took time from his very busy schedule. He's been telling me that he's currently doing exams. So maybe Odinaka, you can open your camera. So Odinaka is welcome, Odinaka.
Thank you so much. It's quite a pleasure to join you and Lorraine on the call.
Good afternoon.
Yeah, warm afternoon from Nigeria.
Absolutely. So Odinaka is connecting from Nigeria. He's a public health specialist, but also a biomedical scientist. He's very active in the malaria community, where he's a notable voice, especially on social media. Thank you for joining us, Odinaka. I'm gonna now give you the floor so that you introduce yourselves to our Young Scientist Network.
Okay, thank you so much, Ndeye. It's been a pleasure actually joining you all on the call today, and I count it a very rare privilege to be engaging with the amazing young scientists that you have on your team. My name is Odinaka Kingsley Obeta, like rightly introduced. I'm a biomedical scientist. I'm also the executive director at Block Malaria Africa Initiative, which is the malaria intervention initiative that is based here in Nigeria, in the northern part of Nigeria, working with communities to help them build resilience against malaria, by helping to bridge the gap between, access to malaria-related interventions, when from the government's perspective and all of that. So we work with young people in vulnerable communities to empower them on different areas, including advocacy, including how to engage government and National Malaria Control program offices with relating to malaria intervention for their community members. We also empower them on necessary skills required for them to conduct sanitation, which is one of the very critical arm of malaria prevention in their community. So, well, a little bit about myself. I was born in a community called Tudunwada, in Jos. Jos is one of the cities in the north central part of Nigeria. In this community where I was born, I lived literally all my life, had my nursery, primary, secondary school there. But then I grew up in this community with quite a lot of challenges. I remember growing up as a kid in Tudunwada, we had a series of challenges. One of them included drug use. Young people my age at the time, we're looking at about 10, 11, 12 years, we're already like venturing into drug use. We had a problem of teenage pregnancy. We had virus-related social vices that limited children from getting access to education because education really was not the priority. So I currently serve as the West African lead for the African Leaders Malaria Alliance Youth Advisory Council, where I'm working with 10 other colleagues to advise African heads of state on how to engage young people in the fight against malaria. I'm also a co-chair of the RBM Partnership to End Malaria Youth Workstream, where today I serve alongside 3 other colleagues, as mentors to a lot of young people who are interested in the fight against malaria globally. And we're also advocating for youth engagement in the fight against malaria at a global level. So quite a lot to talk about, but then this is just to give you a different perspective about who I am, and then to help us kickstart the discussion.
So we wanted to ask you if you feel like the youth is involved in raising awareness about malaria. We have like a majority of participants to this webinar who think that the youth is involved in raising awareness about malaria. So 67% think that statement is true. So Odinaka, I want to hear about how your first your commitment started first. Like, how many years have you been in malaria advocacy, and how did it start really?
This is quite an interesting question. I was reflecting about this. Was it yesterday? I was trying to make a post on LinkedIn. I was just thinking about it. I'm like, how long has it really been, in the fight against malaria? Okay, yeah, I think it's this afternoon, right? It's been 8 years. I started advocating for young people's engagement in the fight against malaria from 2017, and up until now, I've always had the same message on my lips, which is the fact that young people can offer more beyond, carrying placards and participating just in malaria awareness campaigns on World Malaria Day. The young people have a lot to contribute to the fight against malaria, which is one of the diseases that affects them the most. And for the past 8 years, I've been steady, I've been consistent with echoing this singular message. And today, this message has been heard by world leaders. This message has been heard by international malaria organizations and institutions, and a lot has changed in the last 8 years. So talking about how I started, in the year 2017, I was in my second year in school, in medical school, and I had volunteered for this World Malaria Day event that was hosted by the Association of Medical Laboratory Scientists in Jos, northern part of Nigeria. So I volunteered, and my responsibility as a volunteer was going to be to help mobilize other students to come hold placards and march, alongside other individuals. So I had volunteered for this outreach, and eventually we marched, got to the community, and I realized that as young people, the only thing that we were tasked with was just to hold placards and march through the roads. When we got to the community, the adults took over. They gave the messages to the members of the community, and they also distributed the bed nets. We had no knowledge of how that was done. We literally were just watching, and we were not included in that process. But again, I also observed that there are quite a lot of young people in that community, but they were not even called to be a part of what was happening. You just had this meeting happening in the center of the community, and then the traditional leaders, the mothers, the fathers were participating in that activity, but the young people in that community were not included. This became a thing of concern for me because the following year, I would want to also volunteer for a similar project, which was on World Malaria Day, and I would be told that the project was not holding anymore. And this raised a lot of concern for me. I realized how much of an impact distributing bed nets, how much impact it made in the lives of the women, the pregnant women, especially in that community, where I volunteered the previous year. But then I just kept thinking, what then would happen to another pregnant woman in a different community who right now is in need of bed nets and don't have access to it? So this thought led me to, creating an initiative that is going to help empower other malaria endemic communities in Jos, Plateau State, Nigeria. And I mobilized a couple of friends, and we started what we first of all referred to as the Jos Block Malaria Project. This project worked with one of the most vulnerable communities in Jos. We sourced for bed nets and distributed over 100 bed nets specifically to pregnant women in that community. It was not even enough. That's to tell you the size of the community. We also had the opportunity to engage in malaria awareness campaigns through about 10 different media stations. We also leveraged social media to talk about malaria. And for the very first time, people were sharing their thoughts about what causes malaria. So we would ask on social media, what do you think causes malaria, particularly on Facebook? And you see people tell you things like, if you eat too much groundnut oil, or if you cook with too much oil, or like too many stories. Somebody says if you sleep for too long. Do you understand? There are too many myths that were associated to malaria, and this just reflected the need for us to be able to amplify the actual cause of malaria and then empower people with the knowledge to help lead the prevention. The project ran for 2 days, and eventually we called it a wrap. A friend of mine who was previously pregnant and we had worked together on a different activity 2 years ago. Somebody shared with me that she was pregnant and she lost 2 of her babies. When I inquired why she lost her babies, I was told that it's because she had malaria, she had hypomalaria, and she lost 2 of the babies. This was a huge shock to me, and it was a huge concern to me. This eventually became the reason for us to restart that project, the Just Block Malaria project in the year 2019. And ever since we started engaging with the project from 2019, we had not stopped, and we've been able to help quite a number of communities. And so far, so good, because we also kept amplifying our voices online, talking about why young people need to be included in the fight against malaria.
You've had a very accessory role in malaria advocacy at the time in your neighborhood, and you leverage social media not only to find volunteers to join the initiative, Block Malaria Initiative, but you also use social media to dispel myths about malaria and how what is causing the disease and how to treat it. So it's very interesting to hear that, because it's true that around 2018, Facebook was very, how can I say, very popular. Maybe now other social media are more popular. I think today, if you had to do the same thing, you would have to go on TikTok. So I hope you are very proficient with TikTok. So now you were telling me about your current role within Block Malaria Initiative, but you also have this role as how can I say, as advisor within the Africa, within ALMA. Can you tell us more about what it involves and how you interact with the head of states or with the malaria program leaders in your country, Nigeria, and also in the region in West Africa, because we have the Burkina team who says that they are here. So we see you, Burkina team, and we're very happy to have you. And the Uganda team also in East Africa. So if you can just tell us how you are working with ALMA.
The ALMA?
Yes.
Yeah. Okay, so just like I said earlier about my story, talking about some of the things we use social media to do, that we were talking about malaria on Facebook. We are also encouraging community members to take ownership in the fight against malaria, like getting them to know the importance of community sanitation, letting them know the importance of completing their malaria medication, letting them know the importance of sleeping under long-lasting necessary treatment. While we're doing all of that, apparently, we're also calling the attention of international organizations like the WHO to create youth programs for young people to be engaged in the fight against malaria. And the African Leaders Malaria Alliance took note of this particular engagement. And when they made the decision to put together a youth advisory council that would advise African leaders, on how to engage young people in the fight against malaria, they chose to select 11 young people across the continent who have already been involved in the fight against malaria and have been advocating for this same purpose. And the African List Malaria Alliance reached out to me via an email on one fateful day and said, dear Odinaka, we are putting together a Youth Advisory Council to advise heads of states across the continent under the leadership of His Excellency President Uhuru Kenyatta, who was the chairperson of ALMA at the time, and would love you to be a part of this Youth Advisory Council. Kindly reply this email if you're interested. And I'm like, this is what I want to do with all my life. I have signed the commitment to protect young people, from malaria, to protect pregnant women from malaria, and I'm taking every opportunity to do that. So I signed up, accepted the appointment, and eventually started working with 10 of my colleagues in the Youth Advisory Council. Part of our key responsibilities in the council is to, first of all, draft. We worked alongside with the ALMA Youth Task Force team to draft a youth strategy for the African Leaders Malaria Alliance that would run from 2018 to 2030. Right? So this youth strategy was going to guide the nature of our engagement as a Youth Advisory Council. Beyond that, our responsibility was also to help empower young people across the 55 countries in Africa with the necessary skills and knowledge on how to combat malaria, right? This was also another critical responsibility. So we are also tasked with the responsibility of creating what we refer to as National Malaria Youth Corps in each of the 55 countries across Africa. So you asked a very important question. How exactly do we engage heads of states? So the African Leaders Malaria Alliance is a coalition of all the African heads of states. It's more like the African Union, directed organization that is leading the fight against malaria across the African continent. So whatsoever we do as a Youth Advisory Council and whatsoever recommendations we share to the African Leaders Malaria Alliance as a Youth Advisory Council is taken up by all the presidents and all the presidents across the African continent. Through some of the engagements we've had, webinars, Twitter spaces, community dialogues, and a whole lot of others, we've been able to share very critical messaging on the importance of young people, on decision-making table when it comes to malaria elimination. And as a result of our engagement, the African Union in 2021 released the first ever African Union guide for malaria elimination across the continent. I made a contribution to that policy document. It's one of the documents that we have helped that is guiding young people's engagement in the fight against malaria at the African Union level. Again, through our engagement as a Youth Advisory Council, we've been able to establish national malaria youth armies in about 38 countries. Today, we no longer call them armies, we call them youth corps. So National Malaria Youth Corps. And I'm talking about over 4,000 young people across 38 countries in Africa who have been engaged directly and are actively involved in the fight against malaria as we speak, right? Out of these 38 countries where we have young people actively advocating for malaria elimination, about 13 of these countries have been launched and have the recognition and the endorsement of the country's Minister of Health, the National Malaria Control Program in each of those countries, right? As well as the backing and support of the president of that country. And
I hope Uganda and Burkina also are part of that initiative. So we would be pleased to hear about your thought on how the youth is involved locally in your country, and if you can give us also some example. Odinaka, maybe at the end of this webinar, you can also share with us if Uganda and Burkina and Ghana also, which is a country where target malaria is, have this national youth call for malaria. Is the African youth empowered to take action in the fight against malaria? Do you think that you have enough, endorsement from local leaders or national leaders? Do you think that you are well equipped to talk about malaria and to go inside your community or your neighborhood to see what can be done to reduce the disease prevalence? It can involve sanitation. It can involve, awareness campaign in schools or in the campus at university. Odinaka, I'm gonna go back to how you manage your commitments, because as we heard earlier, you have so many things going on, so many projects that I guess require a lot of organization and follow-up capacity. So my next question is about how, well, your, how can I say, your personal opinion. Do you think that, well, you have extensively traveled to bring attention to malaria, whether it is inside Nigeria or in Kenya, as you just mentioned. Do you think that, what have been your experience as a young person? Do you feel like people hear you when you talk? Do you feel like people give value to your experience and to your how can I say, to your proposals when you go to these international events with so many world leaders or continent leaders and so many high level personalities? Do you think that they give you credit as a young person?
Well, to be very honest with you, at first it wasn't. I don't. That was not the case. It was a huge struggle. First of all, being able to speak on issues like malaria and then get the global community to listen to you, and even get even my local leaders in Nigeria to listen. Because at the first point, even my parents, I remember my mom asked me one day, she's like, "What exactly has malaria done to you?" There was this interest that everybody had. They keep wondering, what exactly has malaria done to you? Why are you this much interested in eliminating malaria? And then there's also this feeling that, oh, he's a young person, or they are young people, they don't really know what they're doing. Until we remain consistent with that message over a period of time, and some organizations, some key individuals began to pay attention to some of the things that we were saying. So I would say this, that from the initial onset, it wasn't rosy. We're not being paid attention to, and it even got to the point where I myself, I got timid. It was like when you travel to some of these meetings, some of these global meetings, I get so timid, you get so quiet, you're shocked, first of all, with what you see, because I'm coming from a community where sometimes I can stay without power for 2-3 months and I don't even care. And now I'm moved into this environment where there's air conditioning coming from the carpet, coming from everywhere. At first, it was a huge shock for me. And eventually I realized I'm here for a purpose. I'm here to speak about the issues that affect me and affect my community members. I'm here to speak about issues that affect young people. And sometimes if you don't focus on the message, you get too distracted and you're unable to deliver what is required of you. And I started pushing for my message, and I'm able to tell my story. One of the things that helped me a lot was being able to also tell my personal stories on how malaria affects me and how malaria has affected me. In my fourth year in the university, for instance, I missed my medical bacteriology exams because I had made a trip in the malaria malaria endemic state. And when I returned back, I was diagnosed with malaria. I was taking medication and overslept. I had issues that day. I was dizzy and sick. I couldn't make it to my exams in the morning, right? So personally, I missed an exam because of malaria. I have also lost friends to malaria. So this pain, being able to speak from a point of pain, being able to express myself, started to draw the attention of world leaders, right? And before you know it, international organizations, government began to pay attention to what we were doing. And the African Leaders Malaria Alliance also began to provide a platform for us to amplify our message. Organizations like Malaria No More UK also created platforms for us to feature in advocacy films like the Draw the Line Against Malaria film, right? And then the RBM partnership itself recently also decided to create a youth work stream for more young people to come tell their stories, for more young people to come use their voice to advocate for things like the Global Fund replenishment and other related replenishment that is necessary to protect the life of that one child in different parts of the world. So it's first of all a shock when you get to that global scene, but then you just need to remain focused, and then you need to know that the people you find there rarely hear the stories of how this disease affects communities. You are a member of a community, you are a young person, you've been affected by this issue, you have thousands and millions of people affected by the issue, you know quite a lot of them, and you are in a position to speak to people who have what it takes to create change, people who have what it takes to make contributions, researchers and scientists who have what it takes to go back to the laboratory and begin to work on vaccines, to begin to work on bed nets and all of that. So you have to take your chances and make that contribution, because your voice counts and your voice may be the only thing that can change the story or the dynamics of malaria across the world. So that's what it's been for me, literally.
Thank you. So much dedication. But I have a question because you mentioned that you miss your exams. How do you? It's maybe something that our young scientists can relate to. And I wanted you to maybe share your tips on how to balance your professional career and your commitment as a volunteer. So how do you organize yourself? How do you make sure that you don't miss your deadlines for work or for school or for your block malaria initiative? Like, give us one tip, and then we're gonna maybe go to start the Q&A session so everybody can get a chance to introduce themselves and ask questions to Odinaka. I have already 2 questions that I'm gonna ask, but yes, let's maybe talk about organizing skills before switching to the Q&A. Lauren, you can launch the last poll of the webinar. Thank you.
It's actually a very, very interesting question because every single year I get to deliver webinars. I get to deliver a minimum of about 15 to 20 webinars to different students, groups, and universities and all of that about my work. And one of the major questions you hear every single time is, Odinaka, we know you are a student, or we know you work with ALMA, you work with RBM now, you also have Block Malaria Africa, you have family. How do you manage all of this? It's one of those very interesting questions that come up all the time. The first thing is, let me share with you a bit of my engagement. First of all, I lead Block Malaria Africa, and this is one of my major responsibilities. I have a very amazing team of young people who are actively working to support communities at different points, on different malaria-related projects. I also lead Impact Training Room, is also another initiative that I founded, helping to mentor young people across different professions in Nigeria. We have a Pan-African fellowship that we hold where we teach young people how to grow in their personal development career and all of that. I co-founded about 3 other initiatives. Then I'm West African lead for ALMA Youth Advisory Council. I'm co-chair of RBF Partnership. I'm a master's student, currently studying for a master's in public health, right? And this is a hybrid program. I'm currently in school. I literally have been traveling for the last 5 hours back to school because I have an exam tomorrow, which I'll be studying after the webinar, right? So it's difficult. We have to come to the understanding that all of these things take time, and it's not easy when we start talking about balancing your time or, engaging in all of this activity, because sometimes you need to be 100% across all of them. How do you ensure that you don't fail at any? Because you have to learn which is important per time. So one thing that helps me a lot is learning how to prioritize, because I understand that as a student, I need to succeed with my academics because this is time bound. I also understand that as the executive director of Block Malaria Africa, my attention will be called at different points, and I need to be able to support my team. So I've learned the art of delegation. I work with quite a lot of young people. In Block Malaria Africa, we have more than 500 volunteers, for instance, right? But I don't manage the volunteers directly. We have a volunteers team lead who manages the volunteers. We also have an assistant volunteers team lead, because one person is not even enough to manage the pool of volunteers that we have, right? And then we create a system in such a way that we don't have to do so much work every single time. We create like a schedule, like a calendar. So you engage on projects when it is time to engage on projects, right? One other key thing that helps me a lot, which is something all of us have, but we don't know how to use sometimes, is our Google Calendar. If you have a phone, a digital device, or a computer, you have access to a Google Calendar. You can just open an email with Gmail and have a Google Calendar that helps you to schedule all your activities. Every single day, is important. So you need to plan every day per time. The mistake that a lot of us make is that you want to plan for the whole year or plan for the whole month, and you forget that the success of every month starts from the week. The success of every week starts from the day, and the success of every day starts from each hour of that day. So you must learn to manage your time properly, because every single time you lose, you don't get it back. So per time, I know what my engagement looks like in the year with ALMA. I know what my engagement looks like in the year with RBM. I know what my engagement looks like in the year with Block Malaria Africa. I know what my engagement looked like in the year as a master student. And being a master student is for 1 year. So I know that I need to study for this 1 year and make sacrifices of other programs so that I can give my best.
We don't have a lot of time left, so I would like us to kickstart our Q&A session. we have, the same amount of people thinking that prevention and awareness is a main field where the youth can be activated, and other 50% think also that R&D, research and innovation is also another field where youth are very important to find solutions against malaria. I also wanted to congratulate you on behalf of Chris Tendery, who is a communications lead at Target Malaria Uganda. So Chris says that the talk is very inspiring and that it helps young scientists connect with the initiative that you mentioned, the Youth Corps initiative in Uganda. So if you have any contact, I will be happy to put you in touch with Chris. And he feels very inspired to start something about malaria. So Chris, keep us updated about your plans. And we also have a question from Latif Wedhaogo from Target Malaria Burkina Faso, who has a question. So his question is, Odinaka, is it possible to know more about the challenges when it comes to communication with communities, especially young people? So I don't know if there has been any difficulty in terms of communication that you encountered previously.
Yeah, so there's when it comes to communicating with communities, there are quite a lot of challenges that come depending on where exactly you're working. Because, for instance, in Nigeria, we're multilingual as a nation. We have more than 250 languages, and every community have a language that they're probably familiar with. One of the strategies that we have always implemented in Block Malaria Africa is the concept of mobilizing young people from multiple communities to go lead an intervention in a different community, right? And because of the uniqueness of that particular project that we implement, one of the challenges that we're going to have is when you have volunteers from different communities that speak a different language, and you're moving them to go lead maybe a sanitation project in a different community that speaks a separate language, you have a language barrier, and this becomes an issue. And one way we've been able to manage that, we've come to learn over the years that it's important to be able to work directly with indigenes of every community where you want to implement a project. So that concept has helped us a lot, because even when we mobilize volunteers from different other communities, being able to work with the young people or the youth leadership in the specific community where we're going to be implementing that project helps us to be able to, close that language barrier. And that becomes a very huge thing. Secondly, I mentioned how we use social media a lot to be able to push the right messages. There are communities you go to and you realize that the majority of the population there are not a fan of social media. It's not like they don't use social media, but they don't depend on social media for their messages or for their information, right? If you go to the most remote parts of Nigeria, for instance, social media is not the go-to spot, right, for information. They mostly depend on local radios, right, to be able to get their information. So it took us time to first of all understand that, right? So and then it got to the point where when we go to such communities, we have to identify the radio station that they listen to. We have to look at the program, the specific program they listen to on radio, and we have to ask questions about why they listen to that particular program. When we figure it out, then we find a way to get on that program to talk about malaria, because we know they are going to be listening, right? So this is one of those things. So the challenges are numerous. Every community we go to, we first of all need to study what pattern of communication should work best for that community. We don't just go in because we have a message to pass, and then we know how to pass the message, and we just go in and start sharing that message. No, we first of all study that community, and we do that in our needs assessment phase of our project. We try to ask questions. Sometimes we have to work with religious organizations like the churches, like the mosques, and then we know that the people go to the market, they're usually very busy, but they come to church on Sundays. So we have to work with the churches in that community and get maybe 20 or 30 minutes of their time to talk to the people about malaria prevention. Sometimes we do the same thing with the mosques. So different concept works for different communities. Understanding the needs of that community and understanding what works for the community is what is most critical in ensuring the success of any intervention that we implement. And I think that helps.
That's very important, because we are, I think, 4 communications professionals here today. So it's very nice to hear that experience of yours, because in Target Malaria, we do also a lot of stakeholder engagement, and that involves going in rural areas. And sometimes it's true that the language locally spoken is different from the languages that we speak. Maybe Latif can say something about that a bit later. So it's good to have this feedback and also to be inspired by these by the solutions that you came up with within Block Malaria initiative. Very well. Waiting for your questions, young scientist. Maybe I'm gonna turn to Lorraine. Lorraine, is there a question you would like to ask to Odinaka?
Sure. So one question we have for you is, you're very busy, but maybe 10 years from now, what is something that you've hoped to have achieved, or a future goal that you're looking forward to?
Hmm. That's a very unique question. You know, recently I was thinking through and I was wondering, 8 years ago, when you say that a young person is speaking at a Global Fund event to talk about malaria, it was literally nothing happening. It was not possible that you would see a young person sharing their experience and calling on global leaders to take action, in the fight against malaria. Some 8 years ago, that was not the case. But looking back and seeing how far we started and where we are today, literally every international malaria-related event that happens in different parts of the world, the voice of a young person is represented. We're even at the point where international organizations are beginning to have young people sit on the boards of such organizations. We're beginning to see the Global Fund, for instance, put together a Global Fund Youth Council. We're beginning to see the WHO have a WHO Youth Council, right? All of these things are efforts. These were dreams, first of all, about 8 years ago. They were a dream to me, and today I'm seeing these dreams come true. So I'm currently dreaming for the next 10 years of my life and the next 10 years of the lives of quite a lot of young people. Others. So one of the things that is important for me is that I beyond just speaking and advocating for issues around malaria or universal health coverage, I'm also conscious of my personal and professional development as an individual. My community needs me quite a lot. I did share a little story with you about where I'm from and the nature of my community. Um, Over the years, even while going to school, I've had to make some sacrifices just to help address issues in my community. I've worked with quite a number of my friends to set up, for instance, community libraries to help young people in my community have a safe space where they study and do all of that. And I volunteer there once in a while when I get the chance to be in JOS. I've also set up like a number of other initiatives that are helping young people at that community level. And one of the things I foresee in the next 10 years is that I'm able to institutionalize some of the ideas that we're creating at that community level, because there are a lot of communities that need such intervention, but we need to be able to do same for them. I'm also conscious about building my career as a professional. I want to go back to class. I want to lecture. I want to be a professor. I am currently taking a master's study, for public health. By next year, I'm hoping to get another master's scholarship to go back to school again and study for a second master's. And I want to have a PhD, right? I'm a scientist. I've not forgotten the role of being a scientist. So I'm also pushing to build capacity so that I can also contribute from the standpoint of science and innovation, right? So there's quite a lot. I'm not going to be a youth forever, but the good part is so far so good. I've enjoyed being a youth and I've been able to make a meaning out of it. And that's what matters a lot to me right now. Thank you so much, Lori. I hope that answers your question.
No, yes, definitely. And I think you're definitely leaving your mark. And even once you're not a youth anymore, I think you'll still be valued in the youth space and be seen as a mentor in a way. So yeah, we have lots to look forward to. And we have another question from Rogers from our Uganda team. And the question is, what strategies have you employed to persuade the youth to have an interest in raising awareness in the fight against malaria in the communities you've engaged?
This is a very important question. Thank you so much for that question. I would say this, malaria is considered a disease of poverty. And as a result, even the government of a lot of the countries where malaria is endemic are not interested in investing in malaria interventions. And a lot of the pharma companies also, have limited contribution in terms of funding, funding for research or drug development when it comes to malaria, because the individuals that are mostly affected are poor people, individuals who cannot afford treatment or medication, and a whole lot of that. Because of this same issue, young people across communities, because they've gotten so familiar with malaria. Malaria is not seen as a death sentence, in quite a lot of endemic countries. Young people don't see the interest and the passion to be able to participate in malaria elimination intervention or malaria control interventions. It is so sad that when you look at the pool of young scientists and the pool of young medical professionals that we have, you realize that quite a lot of them are interested in researching cancer. They're interested in molecular biology. They're interested in other areas. When you draw their interest to parasitology, to entomology, to malaria, right? Quite a lot of them don't tend to pick that interest, right? So it's one of those things that we've been changing and we've been working on over the years. So one of the things that has helped us to persuade them is to share stories from individuals who have really been affected by malaria, young people, young children who have been affected by malaria. The way we tell these stories, the individuals who have been affected, who tell their stories, are usually very convincing in such a way that they're able to get others to be a part of this work. One other thing is being able to, share stories of what we've been able to achieve advocating for malaria elimination at the global level. Being able to tell stories about how advocating for malaria can get you to Germany, for instance. Advocating for zero malaria can get you to speak or meet with the president of Uganda, for instance, right? It encourages and inspires these young people to want to be a part of such projects and make a contribution, right? So these strategies have been very effective for us at a local level. And we've also been able to create sports, right? To create sports that, to not create necessarily, but like to leverage sport to advocate for malaria. We know that young people enjoy sports, young people enjoy entertainment. In some communities, it will interest you to know, we usually will hold like a musical concert and get young people to come dance and do drama and all of that. And after they're done or in between, we talk to them about malaria. So we have to keep looking at different concepts that can work with the variety of young people, and we work specifically with the interest of these young people to be able to get them engaged and to be able to get them to contribute in the fight against malaria. I hope this helps, Roger. Okay.
Thank you. We also have another question from one of our team member, Jan Pablo. So Jan Pablo was asking, what was the best advice someone gave you in your career and how it helped you?
I've received quite a lot of advice. You can imagine coming from where I'm from. If there's any English like that, I've received a lot of advice. I happen to be the first person to go to the university from my family. So from my parents alone, I've received like a trailer load of advice. Keep focusing on what you're doing, keep working hard, and all of that. But I think one of the most important advice I've received is the fact that I'm not going to be young forever. I remember one day, I can't recall who exactly shared this with me, but then it was one day and someone said to me, you remember you're not going to be young forever. So now that you're young, what you do with your life is very, very important. The impact you're able to make, your generation and the generations after you is going to remember you for it. So what matters right now as a young person is being able to manage your time and being able to contribute towards solving problems that are bigger than you. You have to dream big, look at challenges that affect other people. You don't necessarily have to focus on challenges that affect you alone. We have to focus on challenges that affect even a lot of other people, and then find a way to find solutions to these challenges. Be the voice of that one person who cannot speak for themselves until a solution is found to a problem that affects them. Because now you have the energy, you have the time, you're strong, you're young, and it's an advantage. Take it. So I think that would have been the greatest advice I've received. And I've utilized that advice so well, and I'm still utilizing it, by the way. Thank you so much.
That's some very good advice for sure. And I think we can all take that with us and keep it in mind as we go forward. And we have one other question in the chat from Aisha from our Uganda
Actually,
team.
yes. Mm-hmm.
And the question is, how do you deal with opposing leaders who are against malaria initiatives?
That's another question to deal with. We were in a meeting somewhere in Berlin about a month ago or so, and just while we were advocating for the malaria vaccine, a team of anti-vaxxers were advocating against the vaccine. And I was wondering, okay, so how do you address an issue like this? Of course, I happen to be one of the youngest in the room alongside quite a number of other young people, and it was not our stake to address the issue. But I was just watching to see what the global leaders who were right in front, what they were going to do about the issue. But then one of the things I think I've learned over the few years of my experience is that as a young person, you just know what is right and you know what you're fighting for. Sometimes having a clear understanding of the importance of what you're fighting for is enough courage. It gives you enough courage. It gives you enough motivation to keep, fighting for that same thing, despite the adversity, despite the challenges that come alongside your way. Not everybody is going to accept what you stand for. Not everybody is going to be aligned with your message. Not everybody is going to agree to work with you or to support you, right? But that should not be a factor that will limit you, right? Or that will stop you from continuing that particular message, especially when you know how much impact that it is having on the lives of the people that you're advocating for or that you're speaking for, right? So I think that is one of the most important things for Aisha. I don't know how that response helps, but then just keep doing what you're doing because not everybody. It's 8 point something billion people in the world. Not everybody will agree with you. Not everybody would click with your message, right? But it shouldn't deter you and it shouldn't stop you. If others who have gone ahead of you were stopped, they wouldn't have been able to create the world that we enjoy right now. I want to believe. Okay.
Maybe one last question before we say goodbye. It is from Bernard, sorry, from Uganda. He's asking, how do you deal with the different backgrounds and how do you tap into the organization that would help with your initiative, and how do you address the different backgrounds, the different mindsets, etc.?
Yeah, so the thing is, everybody wants to listen to you tell your story, but then everybody have different interests on what your story carries as a message, right? Some people want to hear your story because they want to support you. Some people want to hear your story because they believe in it or they believe in you. Some people want to hear your story because they want to use it for research or they want to create a solution for the problem that your story, is passing out as a message, right? So it's just about you understanding where you are, right? Understanding where you are and being focused exactly on what you're doing. The honest truth is you're coming from a background where you've seen malaria affect people, for instance. This is my story. I'm coming from a place where malaria affects me, and I've seen people affected by malaria. I don't expect to talk about malaria to somebody who is from Australia or who is from the USA, for instance, and the person fails to understand. Our different environment, puts us at different opportunities. I am at risk to malaria because of my environment, but this person probably don't even know what malaria is because his environment or our environment doesn't even give her that experience or give him that experience, right? So it's just about talking about how you've been affected, sharing your story, in such a convincing manner that you're able to establish a picture for these people to see where you're from, to see what exactly happens where you are, and then they're able to key into what you're doing, right? I think that helps a lot.
Thank you so much, Odinaka. I think those are very wise words to close this session with. I remind you that Odinaka would be very happy to connect with you on social media. So please feel free to take the link in the chat currently and connect with him on social media, whether it is Twitter or LinkedIn, or you can also send him directly email. His email address is there. So I just want to maybe remind that Odinaka, you were here today with us, and you are the West Africa lead for the African Leaders Malaria Alliance, and you are also the founder and the executive director of Block Malaria Initiative. Thank you so much for making time for the Young Scientist Network. We were very happy to have you today. I think also the young scientists were very thrilled to have this opportunity to exchange with you and to learn from your experience as a vocal malaria advocate.
Thank you so much for having me.
So we wish you good luck for your exam tomorrow.
Very, very, very important.
Very important. And have a nice afternoon, everyone.
Thank you so much, and warm regards to everyone. Thank you for having me.
Thank you.
Bye-bye.
Bye.